Maybach music.
Can anybody out there hear me? Hear me? 'Cause I just wanna say.
Hey, it's Dr. Jared, and in this video, I want to show you how to relieve your sciatic nerve pain in just a few seconds. Yes, these are some of the best stretches and exercises that you can do right at home that have been proven to relieve irritation on your sciatic nerve and help you to feel better fast. Now, before we get started, what is sciatic nerve pain? Well, to put it simply, it's pain, numbness, or tingling that starts right here, usually in the back of your hip, and travels down your leg. Why do we get sciatic nerve pain? Well, you have nerves that start in your brain and come all the way down your spinal cord, and they exit out at each individual level of your vertebrae. Down here in your lower back, there's a few places where those nerves can get pinched or irritated. Usually this happens because of a disc, because of the joint, or because of the spaces between your vertebrae, because of the bone, because of muscles. There's quite a few things that can cause this sciatic nerve pain. The key is, and the way that we treat it, is we need to alleviate that nerve from the thing that is causing that irritation. And that's exactly what these exercises are going to help you to do. I've got 3 different techniques that I want to show you. We're going to do one in sitting, one in standing, and one laying down on the ground. So hopefully, regardless of your pain, regardless of your ability level, you get something from this video that can help your unique circumstance. Now that being said, number 3 is my personal favorite. That's the one that I tend to use the most often with the best results. So if you can, be sure to stick around and watch that part of the video and try those exercises out. That being said, let's get into this right now. Now, all 3 of the techniques that I'm going to show you operate under the same principle. We want to apply different stresses to the nerve to stretch it, or more accurately would be to glide or to floss it out of the area that is irritating it. The best way to explain it is to demonstrate. And so what I want you to do, this is the seated technique. You're going to sit comfortably in a nice firm chair with another chair right out in front of you. Now the irritated leg, so in this example we'll say it's my left leg, so that's the one that has the sciatic symptoms in it. What you're going to do is bring it out in front of you in this position right here. It's important that I mention you want to sit up nice and straight while you do this. So keep your hips nice and tall, keep your chest nice and up in this position right here. Depending on how bad your sciatic symptoms are, that might even be enough of a stretch. That might even kind of reproduce some of those symptoms. That might cause you to feel some of that sciatic pain. If that's the case, this becomes your starting position. You would hold that for as long as you can, 5 to 10 to even 30 to 60 seconds. Come down, give it a break, and then repeat that a couple of more times. So about 3 to 5 times in the day is about what we go for. But if you can tolerate more, the next step, or phase 2 to this, would be to add some ankle pumps. I'm going to point my toes away from me, and you might actually notice a relief in your symptoms if you do that. But then we're also going to pull back towards you. That might cause the symptoms to increase, or an irritation of your symptoms. Hopefully not too much. Keep it within reason. We're going to point again, and then we're going to pull again. And if that one feels okay, typically what I recommend is about 10 to 20 ankle pumps, and then you can kind of come down, and then you can repeat that one about 3 times. If that still feels all right, if you're ready for phase 3, what we're going to do is add a forward lean at your trunk. And so now we're going to get into this position. I want to actually pull the toes towards me. From here, I'm going to keep a nice good posture and lean forward in my trunk as far as I can comfortably go. And again, you might notice a reproduction of those symptoms. I'm okay with it as long as it's not too much. If it's really painful, what you need to do is back off. So try to keep it within a reasonable range as much as possible. And so we're going to introduce this trunk lean, hold that for 10 to 20 to 30 seconds, and then come back up out of it. If that still feels okay, the last and final step to this would be to introduce a chin tuck as well. And so I'm in this position, I'm going to pull the toes towards me, I'm going to lean forward at my trunk, and now I'm just going to tuck my chin down towards my chest. And honestly, I even kind of get a little bit of some sensation in the back of my leg as I do that. So please keep that in mind. Forward lean at the trunk, tuck your chin down into your chest, hold that as long as you can, 10 to about 30 seconds, and then we're going to untuck the chin, lean back, and then release at the ankle. And if you can do that about 5 or so times. We don't want to push this too hard because nerves can get very irritated, especially if they're already in an irritated state. So about 5 of those is a great number to shoot for. That's your sitting technique. Let me show you how to do it in standing. Now the standing technique is going to look very similar. The main difference is we're going to need an elevated surface to rest our foot on. If your symptoms are very acute, I would encourage you to find something smaller, such as a small stool or even a stair. For the purposes of this demonstration, I'm going to do it right here onto a chair. And again, the idea is we want to floss or glide the nerve out of the area of irritation. In this position, I'm going to come and just rest my heel on the chair here in front of me. If that's good, start right there until those symptoms get better. If that feels okay, we can start to introduce the ankle pumps with this one as well. And so point the toe and then pull it towards you. See how that feels. See if that reproduces some of those numbness, tingling, pain symptoms back here. If it does, then that's a good place to start. And again, I would try to hold that for 10 to up to about 30 seconds and then repeat that one 3 to 5 times. If that still feels okay, we can kick on the last step at the hips and with the chin tuck. And so I'm going to pull the toes towards me. And now in this position, I can hinge forward as far as I can comfortably. And again, just until, if that does recreate those symptoms, you don't necessarily want to push this injury. It's not like a no pain, no gain, push through the pain type of thing. Go to the point where it's painful, and then that's kind of our starting position. So if you can, we're going to pull the hips towards us. We're going to hinge forward at the hips until we get a good stretch, maybe some symptoms going on in the back of the leg. If that still feels okay, if you can take it to the last step in this, or the last phase of this, would be to, with the forward lean, and now I'm going to tuck the chin down into my chest. And again, I would hold that for about 10 to about 30 seconds, and then I'm going to unlock the chin, unhinge at the hips, and then come back down out of it. Kind of take a break, give yourself some relief right between those reps, and then we're gonna get right back into it again. And then you're gonna hold that for about 10 to 30 seconds, and then you can repeat that up to about 5 times. That's the standing version of these exercises. I've got one more to show you. Finally, the last version of these nerve glides I wanted to show you is going to be on your back. Now, as I mentioned in the introduction, I feel like this is a little more effective, but it can also be a little bit more aggressive. So just keep in mind that no matter which version that you choose, something is better than nothing when it comes to rehabilitating this condition. So pick something and stick with it, and I hope that you feel better because of it. But let's show you what these supine or on your back nerve glides look like. You're going to lay down on your back. Now in this position, once again, I'm going to assume that it's my left leg that's got the nerve problems, or it's got the sciatic problems in it. I'm going to start by bending my knee and pulling up towards my chest. With my hands, I'm going to grab around the back of my leg, not on the top of my knee, but right here around the back of my hamstring. Now in this position, I want to pull on that knee, and the first thing that I like to do is just kind of mobilize through the hip. So I'll even spend some time right here. If your symptoms are really bad, that could recreate those symptoms. If that's the case, you're going to hold in that position 10 to 30 seconds and repeat from there. That's phase 1. If you can do that though, what I would do is come about halfway and now slowly try to extend at your knee. So it looks like this right here. Again, that's just increasing the stress on that nerve. We're just improving the mobility as we try to slowly extend and straighten that knee out. The further that I pull my knee up towards me, so if I pull my knee way up here, that's going to be much more of a stretch than if I keep my knee kind of down here lower. So keep that in mind. Play with that angle until you find something that you find is comfortable for you. Now, if that one's okay, well, if that one irritates those symptoms, 10-second holds, 10 to 30 seconds, and then repeat that about 5 times. If that one feels okay, what we can do is add the last step would be the ankle pumps to this. So I'm going to start by pulling my knee up. I'm going to then extend my leg out. Now what I want to do is with my toes, pull my toes towards me as far as I can, and then point the toes right back up towards the ceiling. So pull the toes towards you, hold that for about 5 to 10 seconds in that position, and then point the toes back up towards the ceiling. And this is just a great way, again, to stretch that entire nerve out and hopefully kind of floss it or glide it out of that area where it's irritated. And usually what I'll tell people with this one is to perform, about 10 or so of these ankle pumps, come down out of that position, give it a break, and then repeat that 3 to 5 times. It's just a great way to really get that nerve loosened up and moving. So I hope this helps you out. If you're interested in more great help to your sciatic nerve, check these videos from Tone and Tighten out. If you haven't subscribed yet, hit the circle right here to do that. And I hope to see you back here soon on Tone and Tighten.
Yeah.